So your dog doesn't seem as active, doesn't want to run and play, and is limping. We're on the road for this episode of the Paw Report to talk about one of the most common orthopedic injuries in dogs. Dr. Hadley Gleason, a surgeon from the University of Illinois Veterinary Teaching Hospital, will discuss diagnosing and treating CCL injuries. That's coming up.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this On the Road segment. We're at the University of Illinois at the Veterinary Teaching Hospital. Today we're talking about probably something that our guest has seen a lot of and gets a lot of patients into her office to talk about, and that's CCL injuries. And joining me on this episode of the Paw Report is Dr. Hadley Gleason, a surgeon here at the University of Illinois. Thank you for joining us. First time guest
yes,
on the Paw Report.
Yes, thanks so much for having me. I really appreciate it.
And you brought along?
This is Rutabaga. He's one of our trainees' dogs, and he's just along for the ride.
He said, I want to be on TV
he does,
today.
Yes.
Bring my bed in, and I'm going to chill for the next 20 minutes. Well, you're a new guest to the Paw Report, and we always put our new guests on the spot. Introduce yourself. Tell us a little about you and your journey to the U of I.
Yeah, I am originally from the East Coast. I went to veterinary school at University of Pennsylvania, and I originally wanted to be an equine orthopedic surgeon, so did mostly equine horse training all the way through veterinary school, and then I switched to small animal, ended up doing my residency, small animal surgical residency here at the U of I, and then I've stayed on after finishing in 2020.
Excellent, and you love every minute of it.
Yeah,
every day. It's a different adventure, I'm sure. Well, as I mentioned, it's the number one reason probably patients come to see you.
Absolutely.
For consultations, and we're talking about CCL injuries. Can you talk about what that is, and is it accurate to say a lot of clients come to you for that?
Oh, it's completely accurate. I'd say that's probably the most common reason that we see dogs coming to the orthopedic service. And the CCL, it stands for the cranial cruciate ligament injury, so it's the exact same thing analogous to your ACL. So we say cranial cruciate because they're quadrupeds, they're walking on all fours, so the wording is a little bit different, but it's the same kind of thing that you would see for a person.
Now, what causes the injuries, the CCL injuries? Is it more physical activity? Is it more, a degenerative type of problem that dogs develop?
Yeah, exactly. So unlike people, the CCL tears in dogs are a degenerative injury. So if you look at these after the ligament tears, if you looked at it under a microscope, it would look abnormal, it would look diseased, versus in a person, you're playing soccer, you're skiing, and your perfectly normal ACL tears due to unnecessary stresses. So unfortunately in dogs, these ligaments start to degenerate, and then even with normal, running, they're walking outside, they're jumping onto the porch, those kinds of things can lead the ligament to tear.
I'm going to put you on the spot because you brought in a little model behind
you. I did,
you.
yeah, it's right here.
Right here. And maybe that could give our viewers just a little better description of what you just told us as far as
Yeah.
what it is and where it's at.
Definitely. So the ACL, I don't have one on this model, but it goes from the femur, which is the thigh bone, down to the tibia, and it prevents hyperextension. It prevents internal rotation of the tibia, and it also prevents shearing forward. So this model demonstrates that whenever these dogs step down after they've torn their ACL, they step down and their shin bone slides forward. They don't have a solid leg to stand on when they step down, so that's uncomfortable. It pulls on the joint capsule, it pulls on the other soft tissues. It can crush the meniscus, so if any of you all have had an ACL tear, you might have had some meniscal injury. It can crush the meniscus, and it also just feels uncomfortable. They don't feel like they can step down on that leg and be confident that it's going to be there for them. So that's generally what's happening. If the dog doesn't have an ACL tear, they'll step down and it'll feel very solid and they won't have any of that sliding forward.
That leads me into my next question is some signs.
Yeah.
But some may be pretty obvious, others not so much.
Yeah.
Talk about what, if I'm a pet owner and I notice just something a little off, what am I looking for?
Yeah, generally what you're going to notice with this injury is lameness. So oftentimes if they tear it fully acutely or all at once, they're probably going to be non-weight bearing. They'll be holding the leg up. They won't want to put it down. They'll be perfectly happy to run around on 3 legs. Dogs are really tough and you know, they're always in good spirits. They want to play. So even if they have this injury, they'll likely be eating fine, drinking fine, using the bathroom okay, wanting to go outside and play. They just won't put the leg down. And so we'll have owners come in and say, oh, he's not in pain or anything, you know, he's not vocalizing, but the fact that they're not using the leg at all indicates to me that the leg has some pain associated with it, and they're just so happy-go-lucky, they want to please you, they want to enjoy their day, they're just going on saying, oh, I don't need this leg, I'm just going to run around without it.
My dog, because I actually had a Labrador Retriever that had this and did a lot of toe touching.
Yes.
Is that a thing?
Yes, so when they're kind of testing the waters, they're saying, hey, can I put this leg down? And then if it hurts, they'll say, no, I'm not quite ready. And over time, once the inflammation goes down, you know, you get 2, 3, 4, 6 weeks out from this injury, they'll start to use the leg a little bit more commonly. So usually they'll start off very, very painful, not using it at all, and then they'll gradually kind of get to this toe touching or even using it very regularly, just with a lameness.
Do you notice any swelling? Is that part of it as well?
So I can notice the swelling. There's usually some swelling inside the joint that I can feel, and depending on, you know, how tuned in the owner is, they may notice it as well.
So diagnosis. So I notice that my pet is toe touching, picking up the back leg and not walking on it. I call the doctor's office, I bring them in. Let's kind of go through step by step on your end of things, the process to diagnose.
Yeah. So the first step that we're going to do to a diagnosis, we always want to first assess the whole patient, make sure there's nothing else going on that could be leading to this lameness, make sure the heart and lungs sound okay, make sure everything else looks good. Once we've ruled that out, this is just an orthopedic problem. We'll start with a gait exam, where we'll walk your dog up and down the hallway, or maybe watch them walk in the exam room with you to confirm how lame they are, how well are they using the leg or not using the limb. Then we'll do an examination where we palpate the limb, kind of feel for any loss of muscle mass, so muscle atrophy from them not using it for a period of time. We'll palpate for joint swelling as well, any excess fluid in the joint as evidence of inflammation. And then we'll do 2 specific tests generally called cranial drawer and tibial thrust. And what those are doing is testing for that instability in the joint. So when I'm doing those, so for cranial drawer, I'm grabbing these 2 bones, the femur bone and the tibia bone, and I'm trying to get this abnormal motion on the dog. The other manipulation I can't really do on this model, but we're trying to see what happens when this dog's foot hits the ground. We're kind of testing, pressurizing the foot, and then if we see this shin bone slide forward, we can essentially confirm on exam that this is very, very likely to be an ACL injury. We'll also look for other injuries, especially if it's a traumatic event. You know, if your dog was hit by a car or something else, we'll want to test for the collateral ligaments being intact, as well as the caudal cruciate ligament. There's other ligaments in the joint that we want to make sure are okay. It's pretty uncommon for them to tear those, you know, just doing regular things though.
So once you make the diagnosis, you're sure that it's a CCL injury. You're looking at either physical therapy or surgery. Walk us through both of those scenarios and what those entail, but how do you determine which one is better than the other?
Yeah.
And I guess every patient is probably different.
Absolutely. That's the crux of the issue.
Yeah.
So the patient selection is really, really important, and frankly, kind of client selection as well. So making sure that, you know, you and the client are on the same page about what our expectations are for each outcome, and then what's going to be required of each outcome. So I do mostly surgery. I think for most patients, surgery is going to be the best choice. Unfortunately, physical rehabilitation in dogs, especially a larger dog, the bigger the dog gets, we're just not able to create the level of stability that you can in a person. The reason being, with physical therapy, the reason being is that when you look at a person's knee, the top of their tibia, the top of their knee is flat. And so every time they step down, unless they're doing some kind of dodging motion or something like that, their knee is not moving around independently the way that a dog's is. A dog's top of their knee is at an angle, so every time they step down, they're getting instability in that kind of motion and insecurity in their leg. So it's very hard, especially as the dogs get bigger, to combat that with physical therapy. Some people like to ask about putting a brace on. Unfortunately, because dogs come in such different sizes, it's very hard to get a brace to fit appropriately. And then dogs, as I said before, they're really happy-go-lucky. They want to run, they want to jump, they want to play. They're not very good at telling you, oh, this brace is kind of bugging me. It's itching in the back, or it's rubbing in the back, and they'll end up with sores and discomfort and irritation of their skin because they just can't tell us or won't tell us that the brace is bothering them. So it's very hard to do physical therapy on a dog that is as they get larger. Small dogs, sometimes they can do quite well. We'll get them in the water treadmill. We'll try and build up a lot of muscle around this area. And sometimes the smaller dogs can build up enough scar tissue in that around the knee that it will stabilize enough that they don't have as much discomfort. Bigger dogs, much more challenging. And unless there's a contraindication for surgery, generally that's going to be my recommendation for big dogs.
So surgery, what does that look like? I mean, as far as the whole process, the time, and I'm sure there's a lot on the back end that pet owners need to be aware of.
Yeah. So for surgeries, there's a couple different big categories that we have. The one thing that we don't do is reconstruction of the ligament. So a lot of people are familiar with that because that's what they have for their procedure. They'll take a little bit of their patellar ligament or some of their hamstring and basically reconstruct a prosthetic ligament for them in the knee. And we just haven't, we've tried that with dogs, and we just haven't had the success that we have in people, likely because of the shape of the tibia of the dog. The procedures that we typically will do are procedures where we'll cut the bone and we'll change the shape of the dog's tibia to more closely match a human's knee and provide more stability. That procedure is called the TPLO, and that's going to be my number one recommendation for dogs that are larger. Some small dogs, and we'll do this sometimes, but a lot of general practitioners will also do this procedure. Another option is called the lateral fibellar suture, or LFS, where the surgeon will essentially take a suture, basically a big fishing wire, and go from the femur to the tibia to kind of create an analogous or something that acts like the cruciate ligament, but on the outside of the joint. So those are the kind of the two surgical options that we have.
And those, as you mentioned, were really based on size of the dog and injury for you to kind of evaluate, okay, this is the best option. Do they have different outcomes? I mean, long term?
Yeah. Generally, the TPLO, the bone cutting procedure, is going to have the best outcome compared to every procedure that we've compared it to. Generally, those dogs do better on average in the long run. When we put them on, when we test this procedure, we're looking for lameness visually, but we'll also walk them on a pressure walkway that'll say how much they're actually using that leg. And across the board, those dogs do better than the dogs that have the stitch that goes across the knee. That being said, for a lot of people, if you have a little Chihuahua or a dog that spends a lot of time in your arms, they're not trying to be an athlete, they can have a perfectly passable outcome for you with the suture, and it just depends on, again, technique and communicating to the client what's needed afterwards. Our biggest worry with using the suture in a dog is having it stretch or tear before that scar tissue forms around the knee. So dogs that are more at risk of that stretching and tearing are bigger dogs, dogs that are really active, dogs that have some specific anatomy differences in their knee, and so hopefully your surgeon's going to go over that with you and make the decision with you about what procedure to perform.
Post-operative, what can a pet owner expect?
Yeah.
So the dog gets through the surgery, they're doing well, and they go home.
Yeah.
So I'm sure there's probably a very strict regime that pet owners need to try to follow to make sure that their pet heals properly.
Yeah, and this is the hardest part. I always say my part is very easy, doing surgery on a dog under anesthesia. Something I've done hundreds of times at least at this point. The hard part comes when the dog has to go home, and I always empathize with clients trying to restrict your 2-year-old Labrador for a period of 1 to 2 months and have them no running, jumping,
Right.
playing, rough housing. That's very easy for me to write on the release paperwork. Very challenging for you all to do at home, but it is very important to do for success of the surgery. And so often we, as the veterinarian, can help you with having an open line of communication. What is working? Is the dog feeling very crazy? Putting them in a crate? Can we modify this to like a big X pen or a baby enclosure? Can we modify this to they're in a small bedroom that you have? And then can we provide some sedation or anti-anxiety medications to help make it a little bit easier on the owner at home? I always say with surgery, it's a kind of a three-pronged stool. You need the dog to be healthy enough to tolerate the surgery, which is something that we should discuss together, and your vet should be disclosing to you. There's the surgery that we do, making sure that we're using the right equipment, we're choosing the right procedure, and then there's everything that you all do at home. And if any part of that kind of falls apart, then even if you're perfect in the other aspects of the situation, you're going to have a bad outcome. So if a client comes to me and says, I can't restrict my pet, that's not something that it's going to be possible for me, then I shouldn't be recommending surgery because we're not going to have success.
Do you have repeat customers sometimes?
Definitely. So one thing that people may read as they go through is that in dogs, if you tear one knee, because as we discussed, it's a degenerative process that's kind of happening across globally in the dog. The other knee is likely to tear by about 50%. So about half of dogs will tear. Some good news is a recent paper came out is if your dog is older and they tear their ACL, their CCL, it's only a 20% chance they're going to tear the other side. So the older the dog is when they tear the cruciate, the less likely it is that they're going to tear the other side.
You kind of hit on it, but what are some of the complications that, once surgery's over, the dog goes home, pet owners doing everything that they can, but then they do experience some setbacks?
Yeah. I would say one of the more common things that we can see is surgical site infection. So one of the really important parts of going home post-operatively, which is also always another real kind of pain point for clients, is putting the cone on and having them wear the cone so they can't lick or chew at their incision. It feels mean. Same thing with restricting the pet. I kind of liken it to having a toddler. Your toddler doesn't want to go to bed. They don't want to eat their vegetables. They don't want to, put their coat on when it's 0 degrees outside. But as a parent that that's what's important for them and their health. And so it's kind of like you're having a dog post-operative. Right. It's kind of like having a toddler. It's like, no, you need to take your medications. You need to wear this cone. And it feels mean. They might throw a tantrum and be yelling at you. But it's our job to do what's best for them. So keeping the cone on so they don't lick or chew at the incision and introduce bacteria that can lead to a surgical site infection. We can see kind of continued instability. So even with if we put the suture around and then they're a little too active and it stretches, or they lose muscle mass and some of that additional support structure goes away, they might have continued looseness of the knee that might lead to some discomfort. We can see meniscal tears after surgery as well.
Fluid build up?
Usually that's kind of secondary to something else. So if they do have a lot of fluid buildup, to me that says, do they have an infection or do they have a meniscal tear, something else going on? The fluid is kind of a secondary problem that's telling us something else is happening. And then failure to heal. So sometimes when we're cutting this bone, we can have dogs that if they're a little bit older or they are on some medications that might delay their healing, seeing slow healing of that cut in the bone is another thing that we can appreciate.
How do I know what the right decision is for me and my pet? I know that probably every single pet owner relies heavily on the surgeon for reassurance and for guidance, but do you get that a lot from a patient or from the human parent?
Yeah. People like to ask, what would you do?
And it's always that would be my first question. What would you do?
And it's always a hard question to answer because I'm in a very different position than you all. I come to the vet every single day, and so if my dog needed to come back to be seen, I've seen kind of the breadth of what can happen, and so I think I have a very different perspective than a lot of your standard owner might. I think I would say be honest with your veterinarian about what is possible for you at home, what your dog is like, what your dog likes to do, what your financial capabilities are, and a good veterinarian should be honest with you and have that discussion about, I think this is a good idea. Or sometimes I've definitely had clients come and present to me, they have their initial consult, we talk about the restrictions post-op, and they kind of express some hesitation, and I say, well, let's try these at home, try and do these restrictions right now without having surgery, see how it goes. If it goes well, then come back and we can do the procedure. If you feel like you're really struggling, then maybe doing surgery is not something that you all can really handle right now.
Do clients fear the financial end of
Yeah.
what this could mean? Because it's not something that's inexpensive to do.
Certainly not, and I think that's something that as time goes on and we get more and more, we have more capabilities, we're able to do more for your dog now than we were even 5 years ago, and so we're obligated to offer that to you. You're not obligated to move forward with that.
Right.
And so we all empathize. I know we have a lot of trainees, and certainly even myself, some of the estimates that I give to people, I'd be thinking twice about as well. And so it's not wrong to discuss with your veterinarian or whoever you're speaking with that, the hardship, are there other options that we could do? What do those other options look like? And then, when it comes down to it, only you know your finances and what your family can manage. And so if you need time to do that, the blessing of orthopedics a lot of time and for ACL tears is that it's not an emergency. You can go home and you can think about this. You can talk about it with your family. Talk about it with your mom, your kids, your husband, whatnot, and take some time to make sure that you're making the right decision. And that's what we want as veterinarians. We want to have you go in with eyes open and feel that we're in a partnership, we trust each other, and we can move forward for what's best for your dog.
Are most of your clients larger breed dogs, the Labs, the Rottweilers, the Shepherds? I know you mentioned Chihuahuas, and I'm sure you do that on smaller dogs, but are the bulk of your clients bigger dogs?
Absolutely. For ACL tears, it's going to be those breeds that you listed out. We do see this injury with small dogs, and oftentimes it's tied in with having their patella or their kneecap luxate as well. So that's something we see in smaller dogs. We can see it isolated in smaller dogs as well.
In our last few minutes, I guess my question will be twofold, is what's the best advice? And you gave some advice, talk it over with your family. What is the best advice, maybe some other advice you can give to families, and maybe any success stories that over the hundreds of surgeries that you've done, that one maybe stands out, or maybe a couple stand out in your mind as, I was really worried about this dog getting to run and play again. And now he's at the park with his buddies.
Definitely.
So.
I would say, as far as advice goes, I would say be honest with your veterinarian. Be open and honest. If you're struggling at home with a certain part of the recovery, reach out to your veterinarian and say, hey, we're struggling with this. What can we do to kind of mitigate that? Oftentimes we can change some of the medication protocol, or discuss with you, what other things we can do to try to make that a little bit easier at home. It's never going to be pain-free. It's always going to be a little bit of a challenge to go home with a post-operative dog, but sometimes there are things we can do to communicate. And if you think something is wrong, please reach out. We'd rather catch something sooner and be able to jump in and intervene for you than have you show up for your WE check at 2 months and have something have been wrong for a long period of time. As far as success stories, the ones I always love to see are those that come in, perhaps they had surgery somewhere else, or they've been putting off surgery, and they're struggling to get around. We had one little dog who had surgery, I think, at another facility on both knees and was really struggling. She had, I think, had an infection and had torn her meniscus in one knee, and so we did another procedure to revise that knee. And then I'm blessed here to have our rehab service as well, and we really work as a team, all of us, and so they helped her with the water treadmill, doing some physical rehabilitation exercises. The owners were very diligent bringing her back here. They had her boarding here for some period of time for rehab every day, twice a day sessions, and she ended up having a really successful, happy life and was able to run back around with her family. So it's always really nice to be able to provide that for our pets.
Is that with Dr. Knapp, the water therapy?
Yes, yeah, Kim Knapp.
Dr. Knapp is a former Paw Report guest.
Yes,
so
yeah,
she
she's
invited
great.
us into her area and showed us the pool, and quite impressive, nonetheless.
Yeah.
Well, Dr. Hadley Gleason, thank you so much for joining us. Very informative. I learned a lot myself, coming from a pet owner that had this situation happen in my life. Settle down.
Oh, Rutabaga.
He did so good today.
is.
Thanks for joining us on the Paw Report. We didn't mean to wake you. And we thank you, our viewers of the Paw Report, for joining us here at the University of Illinois, the Veterinary Teaching Hospital. Until then, we'll see you next time. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.